Hello, my name is Jose Miranda Velasquez, and this video is for BSN 246-04. This is IV insertion and discontinuation video. I'm in my Nightingale scrubs, and you can see my badge. My supplies are Mr. Miranda's forearm, and then I have saline. I have a needle like so, and then I have my 2 pairs of gloves. I have IV tubing and an IV start kit. All of my supplies have been used due to practice. First and foremost, I would gather my supplies, make my way to the patient's room, and introduce myself. Hello, my name is Jose. I'm one of the nurses here. At the same time, I would perform hand hygiene and check the patient identifiers. Can I have you state your name, your date of birth, and medical record number if you know it? Perfect. This ensures I'm verifying who the patient is, and this is who I'm here to see. After that, I would check the doctor's orders. Okay, perform hand hygiene. Explain to the patient, Mr. Miranda, the doctor put in an order for you to get an IV to continue your treatment here. At this point, I would don a pair of gloves and set everything up. Okay, Mr. Miranda is a patient who came in to get IV fluids. Mr. Miranda today is getting a 20 gauge 1-inch needle, like so. 20 gauge 1-inch needle. I have my flush. So what I'll be doing next is I would remove my IV tubing, or my tubing here, from the packaging, and I'm going to attach it to the flush, and I'm going to prime it. So I'll take my flush, remove the cap, attach the cap to the flush, and then I would remove this, and I want to release the clamp, and I want to prime it. I want to push all the air and bubbles out. So I get at least 1 to 2 drops out of the end here. And then once this is primed, then I'm going to reclamp this. Okay, clamp is on. I'm going to go ahead and set this to the side. From here, I would come to the site. This is the time I want to apply my tourniquet. So with this tourniquet, I need to ensure that it is 4 to 6 inches above the insertion site. You typically could use my 4 fingers and go above, or use that as a unit of measurement. So I am going to take Mr. Miranda's arm here, apply my tourniquet. Nice and tight. Use my 4 fingers. Okay. Here at least I have the, or give or take 4 inches above the insertion site. So I want to make sure the tourniquet is tight, but I also don't want it to be too tight to where I cannot feel a distal pulse. Okay, on Mr. Miranda, I can feel a distal pulse. Okay, at this point, I would take my alcohol, and I am going to clean the site. I want to use my alcohol swab to start at the center and then work my way outward. So, crack that, and then go in a circular motion from the center, and then work my way out. Okay. I will dispose of that. Next, I'm going to grab my needle out of the packaging. I have my needle here. Okay. When inserting the needle in the patient, I always want to ensure that my bevel is up. So remove the little protective sheath, bevel is up. And then with my middle finger on my non-dominant hand, I want to anchor my vein here on the arm. Typically about an inch below the insertion site when inserting. And then I want to go in at a 30-degree angle or so. So here we go. So I'll take my middle finger here, about an inch below the tourniquet, give or take an inch below the insertion site. After I've already palpated, I will palpate, make sure I can feel my vein. Okay, anchor down at a 30 or so degree angle. We'll go ahead and insert. Once I am inserted into the vein, I am looking for flashback. Once I see flashback, I am going to level out and advance the catheter further in about 1/4 of an inch in without releasing my anchor here on my middle finger. So I will advance my needle about 1/4 of an inch in. Okay, once that needle is in, what I want to do is I want to remove the needle from the catheter without releasing the anchor of my vein here. So I am going to release the needle out. The needle is out, safety is on. Typically, at this point, I want to ensure that this is all the way in. However, with me attempting to press the release button, my needle retracted a tiny bit here. At this point, blood should be coming out. Safety is on. Blood should be coming out. This should go into the sharps container. While securing my IV, I can release my tourniquet. And quickly, what I want to do is I want to take my flush that I've already primed and attach that to the end here of my catheter. Okay. Once my flush and my extension are attached to the catheter here, what I want to do is I want to unclamp it and I want to draw back some to assess for blood return. I want to see the blood flow back and return into my flush here. I pull back, I see blood coming out. So then I am going to then, once I have seen blood return, I will go ahead and push the blood and, well, the flush, the contents of saline, into Mr. Miranda's arm. I want to push nice and slow. I don't want to slam it. It'll just be a nice gentle push here. Okay, I pushed about 3 mLs. At this point, without losing track of my anchor here, I will go ahead and clamp. And then I want to discontinue and disconnect the flush from my extension kit. Okay, flush is gone. I will discard that. At this point, what I want to do is I want to stabilize the IV with one hand, and I want to apply my sterile dressing. I want to take my sterile dressing here, my Tiger Derm. I want to remove the backside, and I want to place it on the arm like so. Okay, my IV is now secured. So I've removed the backside and I've applied it. Then at this point, what I want to do is I want to basically secure the loop. So from here, I want to finish with this. I want to finish securing my IV. Okay. I want to, like I said, take the loop and attach it. Secure the loop. That way it doesn't get caught on anything. And I will secure it with a piece of tape. I, at this point, want to avoid putting tape or excess tape over the tubing portion closest to the IV insertion site, because you never know if it needs to get swapped or changed out. But I do need to secure this to the patient's arm so it's not flopping and kind of going everywhere. This portion here gives me the little label section where I will put my initials. It would say the initials, the date, the time, and the size of a needle, which in this case was a 20 gauge 1-inch needle. Grabbing the little ends here, I will take that and use that to secure my loop. Okay, so everything is set for my patient. I will dispose of all of my trash. These, the gauze, I will save because I will need, but I have my IV already in place. It flushes, it is patented, it is secured. I want to remove my tourniquet. Tourniquet is gone. Clean up my trash. At this point, what I would do is remove my gloves, perform hand hygiene, and leave the patient's room to document and chart. So I would document and chart where the IV is, the gauge, which in this case would be a 20 gauge 1-inch needle. Make sure that it's patent, that it flushes, and so on. So if I don't document, it's like it didn't happen. To discontinue, once we were done with treatment with Mr. Miranda, what I would do to discontinue is, I'm back to discontinue, so I would perform hand hygiene first and foremost. I have my gloves. I'm gonna don my gloves. So at this point, I have my 2 gauze here. And then I have my tape. And I'm going to start by removing the tape that's on the patient's arm, here slowly and gently. While stabilizing the IV, of course. I'm going to slowly remove the dressing, the Tiger Derm from each corner. and then I want to place a piece of gauze over the insertion site while removing the catheter. So I'll start by removing the tail end here. This is now free again. What I want to do at this point is remove each little corner while securing, putting my finger in the middle of the general area. I don't want to press down on the catheter itself, but I do want to make sure that I don't rip it out while removing the tiger derm, or in this case the tape. Last thing I want is to hurt the patient here, Mr. Miranda. Okay, the tiger derm is pretty much free here. I want to make sure that the IV, the catheter itself, is not moving. What I want to do is I want to take my gauze and I want to place it right above the insertion site, so then I can then freely remove the catheter while applying pressure to where the catheter or the IV once was. So once the catheter is removed, what I want to do is a couple of things. Typically what I want to do is I want to inspect the catheter, the end of the catheter primarily, and ensure that it is intact. I want to check the length of the catheter as well. In this case, it's an inch, roughly about an inch. What I don't want, or what I'm looking for primarily, is to make sure that it is intact and it didn't break off or there's a piece stuck in Mr. Miranda's arm. This will just be disposed of in the sharps container, so that's trash. I want to hold at the site where I removed the catheter about 30 seconds. After about 30 seconds, I want to check for blood. Okay, in this case, there is none. So once I check for blood, make sure there's none, I will dispose of it. I will then take my next piece of gauze, and then I take a piece of tape and secure it over the insertion site. Like so. Once it is taped, I'm done. I will then check, throw my trash away, my supplies, make sure Mr. Miranda is comfortable, in which case he is. My supplies are tossed, nothing's pending, primarily my sharps are disposed of. Want to clean up after myself. Then I would remove my gloves, throw that in the trash, perform hand hygiene. I would want to leave the patient's room, and then I want to document. Make sure that I document that I removed that IV from that location that it was in. And I want to document that the catheter itself was intact, no abnormalities. That's pretty much it. Leave my patient's room, document everything, so that if I get questioned tomorrow, it's all charted and documented. So, thank you.